Bombshell. We have Public Health Agency of Canada documents proving Theresa Tam knew but stayed silent about the confirmed person-to-person spread of the coronavirus as early as January 15th, 2020. Tam chose her foreign World Health Organization bosses over Canadian citizens. Theresa Tam is one of just 7 people on the Oversight Committee of the World Health Organization, a UN racket that has been described as a co-conspirator with China, playing an integral role in legitimizing Chinese propaganda and lies about how the coronavirus was first spread and now about the numbers of infected within China. The documents I have today are incredibly damning. They lay bare the timeline of what Theresa Tam knew and when she knew it. Worse yet, these documents have been sitting there in the public domain, presented to the Health Committee last month. But the stenographers in the media party with their endless resources and government bailout bucks, well, they couldn't be bothered to read these documents. The documents are labeled a, quote, situation report on the coronavirus, and they're marked for internal use within the federal health portfolio, the Government of Canada, and the provincial and territorial governments. January 15th, Tam was first made aware by her own internal agency officials that China was lying and that the virus was moving person to person, and yet she and Canada's health minister chose instead to parrot World Health Organization falsehoods that were in direct contradiction to what agency officials were saying to Tam behind closed doors. So let's get right into these documents meant to inform Tam and the health minister. Look at this from January 15th. Potential person-to-person transmission between a husband who worked within the Wuhan seafood market and his wife, who had no exposure to the market, has been identified. Media sources have also reported the less likely possibility of a person-to-person spread in another 3-person cluster of Wuhan cases, a father, son, and nephew, who all worked within the seafood market. This is 2 full weeks before the World Health Organization told the globe that there was no evidence of the human-to-human spread of the coronavirus. Theresa Tam's agency, the one that exists to prepare Canada for a pandemic, was told of human-to-human spread. Yet to this day, Theresa Tam's agency tells Canadians to rely on the World Health Organization as a trusted source of pandemic information. Now, in that same situation report, the officials noted the Public Health Agency of Canada's assessment of public health risk associated with the coronavirus in Wuhan, China, was updated as of January 14th, 2020 to consider the potential for exposure beyond the Wuhan seafood market and limited human-to-human transmission. And in the same document, officials note and continue to note that the World Health Organization advises against the application of any travel or trade restrictions on China based on the information currently available. That information, of course, is the information that the virus was spreading person to person. It's inexplicable, really. The same briefing note indicated that the American Centers for Disease Control seemed sufficiently convinced that the virus was spreading person to person. Now, this wasn't the only time, though, that the Public Health Agency officials were sending warnings about person-to-person spread of the coronavirus. 2 days later, January 17th, in another situation report, officials warned again of the exact same thing, of the spread of the disease from a husband to his wife who had no exposure to the seafood market, and of a 3-person cluster being reported in the media. The same warnings again from the CDC were noted. Now, on page 188 of these 400 some odd documents, the Public Health Agency officials warned, based on a UK study, that the spread of infection in Wuhan was much worse than the Chinese government was letting on. This is in a January 19th situation report. And yet, in April, graphic designer turned Sinophilic Health Minister Patty Hajdu was still swearing by Chinese numbers and reporting. Just look at this. Researchers from the United Kingdom have recently used modeling studies to hypothesize that the extent of the transmission within Wuhan is greater than has been reported. Theresa Tam, after learning about the real spread of the virus, that in China it was moving person to person and that China was lying about it, still told Canadians not to wear masks and not to protect themselves and others, only to change her mind on masks just a week later. And why? 11 days after that first January 15th warning, did Dr. Theresa Tam tweet this out to Canadians? There is no clear evidence that this virus is spread easily from person to person. The risk to Canadians remains low. Find out more on the government coronavirus website. Again, that's 11 days after she was informed by her own officials that the virus was indeed spreading person to person. She tweeted out a lie. Why did Tam disregard her own officials' warnings and those of the American CDC, as well as UK researchers, warnings that said that China was obviously lying? Why did Tam instead rely on the World Health Organization that was in turn relying on unreliable Chinese government reporting? Well, it's because Tam works, as I pointed out earlier, not just for the Canadian government, but for the Chinese-controlled World Health Organization, China's co-conspirator, as a member of the 7-member Oversight Committee. Tam knew, and she kept silent, and perhaps even worse, gave Canadians health advice to the contrary of what she knew. The World Health Organization's well-documented political corruption happened on her watch, when it was literally her job to stop it. We've seen it all unfold in real time, both in these documents and in Tam's public statements, and then her constant reversals. Tam either approved of China's meddling or was willfully blind to it. That's what these documents prove. You cannot work for the China-centric World Health Organization and then claim to be looking out for Canada too. The World Health Organization works for China, polishing China's lies. That's obvious. When the World Health Organization's interests collide with China's, Tam chooses the World Health Organization. None of this is about Tam's race, and it's not because of her gender either. We're still allowed to question the government, its agencies, and the heads of those agencies, especially when their actions are so egregious without being told to shut up with poisonous accusations of racism. This is about Tam's obvious failure to act on vital information she had early on from her own officials, and it's about her loyalty to the UN World Health Organization. Tam works for them, and that conflict of interest has left people dead, and the True North strong and free under house arrest. Lives are ruined. The economy is in tatters. We have to fire Theresa Tam. We have a petition calling on the government to fire Tam at firetam.com. Please sign and share that petition. At that special website, you can see all of our previous reporting on Theresa Tam's failures. That's at firetam.com. She put Canadians in danger. Tam ignored her own officials' warnings, and she needs to go immediately. For Rebel News, I'm Sheila Gunn Reid. Dr. Theresa Tam, the head of Canada's Public Health Agency, also works for the World Health Organization, a UN body that has been described as a co-conspirator with China. She should be fired. To sign our petition calling on the government to fire Dr. Theresa Tam, please go to firetam.com.